I am Cadet Staff Sergeant Shane Hatamosa, and I am your first class officer. And for today's video, we will be talking about first aid training. So here are the topics we're going to conduct. First is how to treat nosebleed. Second is fainting cause and treatment. Third is what to do when someone is choking. Fourth is how to treat fracture and fracture types. Fifth is CPR, how to do CPR. Sixth is first aid and to restore breathing. And what are the learnings you will get after discussion of first aid training? First, you will learn how to save lives. Second, you will know what are the basic types of or how to rescue your loved ones, your friends, even strangers. Importante sa lahat, maging isang kalmado sa sitwasyon. Dito mo lang yung matutunan sa ROTC. And again, paminaw din ako. And what are the learnings you will get after discussion of first aid training? First, you will learn how to save lives. Second, you will know what are the basic types of doing things, how to make or how to rescue your loved ones, your friends, even strangers. At ang importante sa lahat, maging isang kalmado sa sitwasyon. Dito mo lang yung matutunan sa ROTC. And again, paminaw din ako. Again, gusto na bang makatuon? Gusto na bang makibaw? Ayaw na pagdugay-dugay. Dali, paminaw na ako. Kay Matik, dali na kasabot. So our first topic for today is how to treat nosebleed. So please watch this video.
When someone is having a nosebleed, your priority is to control the bleed and keep the airway open. Help them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward, never backwards. This ensures that the blood drains out through the nose rather than the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch any blood that may drain out. After 10 minutes, release the pressure. Reassess. If the bleeding has not stopped, apply the pressure for a further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleed after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down, leaning forward. Pinch the soft part of the nose. And if necessary, call for an ambulance. And that's how you treat a nosebleed.
Let's proceed to the second topic, the fainting cause and treatment. So mga napuyapan diha sa mga kanitlang katiurok. So this is for you. Stop, look, and listen.
People may faint as a reaction to pain, exhaustion, hunger, or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come around after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold, and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Let's proceed to third topic. Don't get boring, stay up, stay well.
If you think an adult or child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrust, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
The fourth topic is how to treat when person suffered a fracture. For example, imong kamot na bali, imong bagtak, imong singkod rin na unsa ba nas basket. So here the tip.
A break or crack in a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack or bend quite easily. A bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. Fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
In this tutorial, we're going to look at the treatment for strains and sprains. Our treatment for a strain or sprain is, we use the acronym RICE. You rest the injured limb, you place ice on it, you put a compression bandage on it, and you elevate it. Our casualty here, I'm going to expose the injured limb. I'm going to use my kit bag here, and I'm going to elevate the limb. Next thing, I want to put some ice on it. So when we use an ice pack, we never put it directly on the skin, we always use a bandage. Here I have my instant ice pack, I'm going to break, distribute the contents evenly. Now I'm going to wrap it up. And now I'm going to place this over the injury. I'm going to leave this here for 10 minutes to cool down the injury and also help reduce swelling. After the 10 minutes, next I'm going to use a compression bandage to put compression or apply pressure over the injury. They come with a clip. We're going to discard the clip and we'll use tape to secure it. So you start above the joint, secure your bandage, you come down and we're going to do a figure of 8 around the injury and back up, and we're going to keep doing this. We're going to use the whole of the bandage and keep it good and tight. So continue doing our figure of 8. As you will notice as we're doing it, the heel is going to remain exposed, but we're keeping good pressure on the injury to keep the pressure on the joint. So once you come to the end of your bandage, again you're going to use the whole of the bandage. I'm going to secure it here around the ankle. Again, open it fully, and again I'm going to use 2 pieces of tape to secure the bandage in place. And our last part of the treatment, we need to keep the leg elevated, and as you can see it's elevated here on my kit bag. And that is the treatment for a sprain or strain.
So the last topic we're going to talk about is how to rescue someone who has a problem in breathing, to restore their breathing. So here are the tips. What are the steps you are going to execute and how will you do it? So let's see.
Task: perform first aid to restore breathing and/or pulse. Conditions: During daylight, you see a casualty who is unconscious and does not appear to be breathing. You are not in a combat situation or chemical environment. Standards. Within 5 minutes, take appropriate action to perform first aid to restore breathing and/or pulse. In sequence. 2. The candidate continues until the casualty breathing or pulse returns. Performance Measure 1. Perform first aid to restore breathing and/or pulse. Alpha. Roll the casualty onto back and place on a hard, flat surface. 1. Kneel before the casualty. 2. Raise the near arm and straighten it out above the head. 3. Adjust the legs so they are together and straight or nearly straight. 4. Place one hand on the back of the casualty's head and neck. 5. Grasp the casualty under the arm with the free hand. 6. Pull steadily and evenly toward yourself, keeping the head and neck in line with the torso. 7. Roll the casualty as a single unit. 8. Place the casualty's arms at the sides. Bravo. Open the airway. 1. Head tilt, chin lift method. No spinal or neck injury is suspected. Alpha. Kneel at the level of the casualty's shoulders. Place one hand on the casualty's forehead and apply firm backward pressure with the palm to tilt the head back. Charlie, place the fingertips of the other hand under the bony part of the lower jaw and lift. Delta, bring the chin forward. Charlie, check for breathing. 1. While maintaining the open airway position, place an ear over the casualty's mouth and nose, looking forward, the chest and stomach. 2. Look for the chest to rise and fall. 3. Listen for air escaping during exhalation. 4. Feel the flow of the air on the side of the face. Delta. Give breaths to ensure an open airway. 1. Maintain the airway and gently pinch the nose closed using the hand on the casualty's forehead. 2. Take a normal breath and place your mouth in an airtight seal around the casualty's mouth. Delta. Give breaths to ensure an open airway. 1. Maintain the airway and gently pinch the nose closed using the hand on the casualty's forehead. 2. Take a normal breath and place your mouth in an airtight seal around the casualty's mouth. 3. Give 2 breaths, 1 each second, taking a breath between them, while watching for the chest to rise and fall, and listening and or feeling the air to escape during exhalation. Note, you see the rise and fall of the chest. Echo. Check for a pulse for 5 to 10 seconds. 1. Use the first 2 fingers in the groove of the casualty's throat beside the Adam's apple on the side closest to you. Note, do not use thumb. 2. You find a pulse, but the casualty is not breathing. Alpha gives breaths at the rate of 1 every 5 to 6 seconds, 10 to 12 breaths per minute. Bravo. Recheck for pulse and breathing every 2 minutes. Charlie. Continue until the casualty's breathing returns, a qualified person relieves you, a physician stops you, or you are unable or too tired to continue. Note, the casualty's breathing has returned. Foxtrot. Once the casualty is breathing and has a pulse, place the casualty in the recovery position. Note, the person's arm that is nearest you at a right angle to their body, so it is bent at the elbow with the hand pointing upwards. Gently pick up their other hand with your palm against theirs, palm to palm. Now place the back of their hand onto their opposite cheek, for example, their left cheek if it is their right hand. Keep your hand there to guide and support their head as you roll them. Use your other arm to reach across to the person's knee that is furthest from you and pull it up so that their leg is bent and their foot is flat on the floor. Gently pull their knee towards you so they roll over onto their side facing you. Their body weight should help them to roll over quite easily. Move the bent leg that is nearest to you in front of their body so that it is resting on the floor. The position will help them to balance. Gently raise their chin to tilt their head back slightly, as this will open up their airway and help them to breathe.
And we are done discussing the 6 topics we had, and I hope you will learn from it and you will get some of it. And this is me again, Shane Hatamosa, your first class officer, your cadet staff sergeant, and bye.